Swelling of hepatocytes called ballooning, which occur in hepatitis. There are two type of hepatitis: acute hepatitis and chronic hepatitis. So the hepatocyte, the liver cell, when they swell, this is known as ballooning. Okay, the presence of apoptotic hepatocytes giving rise to councilman bodies. Apoptosis of single hepatocyte is called spotty necrosis. The apoptosis of single hepatocyte is known as spotty necrosis. Disruption of lobular architecture of the liver. Necrosis connecting portal to central, and the central to central regions of lobules is called bridging necrosis. This all occur in the acute hepatitis, and infiltration of the portal tract with inflammatory cells. Spilling of inflammatory cells in the adjacent parenchyma causes necrosis of adjacent cells. The spilling of inflammatory cells in the adjacent parenchyma causing necrosis of adjacent cells. Now there is chronic hepatitis. Chronic hepatitis is caused by viral hepatitis, autoimmune hepatitis, and drug associated hepatitis. Histological activity or grade. The grading is based on necrosis and inflammation, which include assessment of the periportal necrosis, include piecemeal necrosis and bridging necrosis, portal inflammation, intralobular necrosis, and fibrosis, and the degree of progression of the stage. Firstly, there is Hepatitis A virus. It is benign and self-limiting disease. The incubation period of Hepatitis A virus is 2 to 6 weeks, and it does not cause chronic hepatitis. And the HIV, the Hepatitis A virus, is an unenveloped single-stranded RNA virus belonging to picornavirus family. Fecal-oral route is there. Okay, and Hepatitis A virus is present in stools 2 to 3 weeks before and 1 week after the onset of jaundice. IgM antibody appearing in the blood with onset of symptom is a marker of acute infection, whereas IgG antibody provide lifelong immunity. IgM appearing in the blood is a marker of acute infection. Okay, now Hepatitis B virus. Serum hepatitis, it can cause acute hepatitis, non-progressive chronic hepatitis, progressive chronic hepatitis leading to cirrhosis, fulminant hepatitis, carrier state, hepatocellular carcinoma. Incubation period of Hepatitis B virus is 30 to 180 days. Hepatitis B virus is present in all physiological and pathological body fluids except in stool, unlike HIV, unlike Hepatitis A virus. Okay, the mode of infection of Hepatitis B virus is blood products, needle sticks, and sexual transmission. Okay, vertical transmission is responsible for development of carrier state. The virus is double stranded DNA belonging to Hepatitis Aviridae family. Okay, it is spherical, double layered Dane particle 42 mm in size. Hepatitis C virus, transfusion associated hepatitis. HCV, a single stranded RNA virus belonging to Flaviviridae family, 2 to 26 weeks. Incubation period. Acute Hepatitis C virus infection is generally undetectable. Okay, and whereas chronic disease occur in majority of infected individual. Spread of virus is through inoculation and the blood transfusion. Sexual and vertical transmission are less common. Okay, acute illness is usually asymptomatic. Initially there is IgM anti-HCV followed by the presence of IgG anti-HCV antibody. Okay, the episodes of elevation in serum transaminases with the intervening normal period associated